2010 was meant to be the year to celebrate the achievement of universal access to HIV prevention, treatment, care, and support. Yet, while we have had successes, 5 million people are now on treatment globally, a 10-fold increase over only 5 years, and new HIV infections worldwide have dropped by 17% since 2001. Despite these successes, HIV prevention services are only reaching a fraction of the people who need them. For every 2 people starting treatment, 5 more become infected with the virus. AIDS continues to ravage families. 1 out of every 5 maternal deaths worldwide in 2008 was linked to HIV. In South Africa, it was nearly 1 out of 2. HIV is the leading cause of death among women of reproductive age. I believe we can all support a comprehensive approach to HIV prevention that includes a range of evidence-based strategies, delaying sexual debut, reducing numbers of sexual partners, protecting against sexual transmission of HIV, and yes, the use of condoms. We are not asking religious leaders to hand out condoms unless that is acceptable within your tradition, but to partner with us in approaches to HIV prevention, education, healthcare, and referral in ways that allows each partner to work in their areas of strength. But I would just like to end by asking all of you to stay involved. You are the activists, you are the advocates, you are the practitioners, you are on the ground. Your personal leadership and commitment are vital to making a real difference, to move people forward from just talking to action. You can energize social movements. There is so much more that unites us than divides us. In our response to HIV, we are all in this together. Success depends on our collective efforts. UNAIDS looks forward to working and partnering with you in this year and beyond to save lives, to fight for social justice, and to make progress towards the Millennium Development Goals. Thank you.
How do our faith traditions compel us to work towards universal access to HIV treatment, care, support, and prevention? To answer this question, I think we should feel a little bit how odd the question really is. If we changed the word or the acronym HIV with any other name of a disease, what would happen? I think we would all feel that, why do we ask this question? This has to do with my understanding of another being as a person created in the image of God. This has to do with what is called the one most important commandment to all of us, the double commandment to love God and to love our neighbor as ourselves. This has to do with the basic issue about justice. Justice between genders, justice between people living in different parts of the world, justice between those who are in a healthy condition and those who are in need of health treatment and care. And I will use this opportunity to really express my deep respect and also my high appreciation of any who use their faith as an inspiration to address the HIV pandemic. Anybody who cares, anybody who does this, whether it is seen or not seen. I think many of us know that much more is done than what is seen. And I think we should also use this occasion to honor, particularly those who care for their neighbor, whoever he or she is. in an unseen way. But also those of you who make this a big issue, who make this very clear in international politics, who make it very clear in our church bodies that this is high on our agenda, whether we are Christians, Muslims, Jews, or whatever we are. This is something that really matters for us as people of faith.
As we all know, and you're better than myself, that AIDS, HIV now is pandemic, not only epidemic. It's a pandemic. And if we talk about treatment of the sick as a part of our challenge here, once upon a time, God said to one of his slaves, I became sick. Why didn't you come and visit me? He said, oh Lord, how can you become sick? And you are the Lord of the universe. You know what Lord told him? Didn't you know that this lady or this man are sick and you have never visited them? If you could have visited them, you could have found me there to help you. And this is the universal declaration of God towards any sick individual. Any sick, not a Muslim or a Christian or a Jew. The next door neighbor to the prophet was a Jewish man. His son was sick, and he went to visit him and sit down to comfort his heart and his father's heart. And this is the relationship. Religion cross boundaries, cross barriers, not make barriers. Some of the human interpretation of religion make the barriers because of the lack of knowledge of the interpreters, not the lack of knowledge of God who revealed the religion. The teaching of Jesus, peace be upon him, the teaching of Moses, peace be upon him, the teaching of Muhammad, peace be upon him, crossing all the barriers to gel humanity, to have one humanity, one human heart, one human vision for all of us. So if we want to use religion, we should let religion to lead through the humanitarian dimension of the global teaching of the best of teachers of humanity, which I mentioned their names as well as others.
I can say as a young woman, when I was 8 years, I already knew I was gifted because I come from 2 generations of traditional healers, my grandmother and my great-great-grandmother, which I was fortunate to spend a lot of time with them as a very little girl. And I was very confused when I was young, seeing everyone coming home to see my grandmother, getting all the necessary things. They're coming, they're crying, they're leaving, they're in another space again. They're carrying things. If they were hungry, they're taking even the smallest amount of food that we had. They're sharing, we were sharing, and so much, love. We are faced with different problems because people come without anything. They don't have food, they don't have money to even pay for the smallest service, but they expect something out of you. So, which means you're going to have to overlook that and just help. You are not doing this for you. This is a calling. So that's the message that you have to take. And then in partnering, which is very important, we've always made sure that we partner with doctors, with everybody, because we don't have what I would call the exact answers.
I would like to end us with one challenge, a challenge which comes from the conversation we've had here, but also the conversation we've heard from the young people. How are we as a faith community, as faith communities, how competent, how ready, what are our skills or knowledge to respond to the issues of young people living with HIV who wants to form families? and she was born positive, or he was born positive, or he is positive and she is positive. And she comes to us as people of faith to advise around medicine, to advise around prevention, for advice around so many other issues. How competent are we in our daily responsibilities to go beyond providing the treatment, but the counseling, the advice, the nurturing? What are the tools that we have? That is a question that remains with us all the time. The issues of social relationships, of love, and saying it's okay.